The police force and the ambulance service are two distinctly different branches of the emergency services. Although noticeably different by design, how do these services differ in terms of language use and physical interaction? Through an analysis of two documentaries, one following the police and the other the paramedics, we will be examining the interactions between each service and an intoxicated person. One fundamental difference between these two interactions is the language used in conversation. In the scenario of paramedic and patient, the paramedic frequently poses questions such as, "Have you hurt yourself?" and "Do you want to come and sit in the ambulance?" This interaction displays a self-selection form of turn-taking, where the paramedic continually formulates questions that encourage the patient to respond. The responses that the patient gives then allow the paramedic to determine the level of emergency and enact an appropriate response. On the other hand, in the scenario of police and perpetrator, the police officer is firmly in control throughout the interaction. Instead of communicating through questions like the paramedics, the officer makes short, concise statements, such as, "Turn around now," and "You're under arrest." These statements do not require response but are instead intended to give a level of understanding in order for the officer to remain in control. When the officer does pose a question to the perpetrator, they are often closed questions, such as, "Do you understand?" and "Anything on you that you shouldn't have?" Although both the police and the paramedics control the flow of conversation through questions and statements, there is a noticeable difference in approach. To understand why the paramedics adopt a more compassionate approach, while the police are more commanding, we have to analyze the physical interactions that take place. The concept of impression management can be determined through external factors, such as status and level of education. Notably, in the interaction with the ambulance service, the paramedics kneel down in order to communicate with the patient, thus creating equality between speaker and listener. Whereas the police undertake the action of handcuffing the perpetrator in order to arrest them and bring them to the station, which defines both their authority and control. A subset of impression management is pragmatics, a concept that involves examining the context of a situation in order to interpret its meaning. In these scenarios, the meaning of action. It is therefore important to recognize that in both scenarios, the member of the public involved is intoxicated, and therefore their behavior would be more unpredictable. In the interaction with police, the officers are working within the context of an intoxicated person committing an offence. Therefore, their actions of arrest are meaningful in gaining control of an unpredictable situation. On the other hand, the paramedics are dealing with a more predictable context. Although they are also dealing with an intoxicated person, their interaction is centered on the health of the patient, not the context of an offence. Physical interactions that evolve from situational context is crucial to establishing what kind of impression each service is maintaining. For the paramedics, it's approachability, whereas for the police, it's authority. Additionally, the concept of framing and knowledge schemas can offer an insight into how both conversational and physical discourse influence an interaction. Knowledge schemas in conversation reflect the unconscious expectations that participants have when entering into an interaction. In both scenarios, it is crucial that the police and the paramedics express their knowledge schema clearly in order to ensure they are in the same frame as the person they are speaking to. An example of a shared schema can be seen in the interaction of paramedic and patient, with the paramedic stating, "We can't leave you here," and "We won't tell anyone," in response to the patient's fears that his parents might find out about his situation. However, in the scenario of the police, there is a shift in frames, due to a mismatch of knowledge schemas, as the perpetrator wants to escape, but the police have the power of arrest. Thus, the police control the outcome of the frame. The paramedics are more compassionate with their actions because there is less risk involved. Both the paramedics and intoxicated person share the same knowledge schema of providing and receiving healthcare. Whereas the police are more commanding because there is a mismatch of knowledge schemas. The police intend to arrest the offender, but the offender intends to evade the police. For the institutions of the police force and the ambulance service, analysing the current language and physical interaction used by active members can help to train prospective employees. Through conversation analysis, impression management, and knowledge of frames, the findings in this presentation could assist each service in improving or reinforcing current strategies in situational conversation.